Good morning, my handsome men. Let's do a very simple erectile dysfunction and heart health self-check. In the next 30 seconds, you're going to get a quick snapshot of whether your body may be showing signs that ED is part of a bigger blood flow story right now. No panic, no complicated cardiology language, no guessing, just honest answers. If you are over 60 and you've been noticing weaker erections, less firmness, lower stamina, more shortness of breath, or a body that just does not feel as strong and responsive as it used to, this matters more than many men realize. Because erectile dysfunction does not always begin as a sex problem. Sometimes it begins as a circulation problem. And in some men, that means ED may show up before a more obvious heart warning ever does. I'm Dr. James Whitaker, and here is how this works. You are starting with a perfect score of 7 points. I'm going to describe 7 signs and risk patterns. For each one that applies to you, subtract 1 point. At the end, you'll have a clearer sense of whether your body may be showing a broader pattern worth paying attention to. And stay with me until the end, because the #1 mistake men make with ED and heart risk is the one that keeps them treating a vascular warning like it is only a private frustration. Let's begin. You start with 7 points. Number 1. Do you have high blood pressure, high cholesterol, diabetes, or a history of smoking that could affect blood vessel health? If yes, subtract 1 point. Number 2. Have your erections become weaker, less reliable, or harder to maintain over time even when your interest is still there? If yes, subtract 1 point. Number 3. Do you get winded more easily than you used to when walking, climbing stairs? If yes, subtract 1 point. Number 4. Have you gained belly fat, become less active, or noticed a drop in stamina over the last few years? If yes, subtract 1 point. Number 5. Do you have poor sleep, heavy snoring, or nights that leave you tired and unrestored the next morning? If yes, subtract 1 point. Number 6. Have you started treating erectile dysfunction as a separate bedroom issue instead of wondering whether it could reflect your circulation or heart health too? If yes, subtract 1 point. Number 7. Have you delayed paying attention because there is no chest pain, no dramatic event, and no single moment that forced you to take it seriously? If yes, subtract your final point. Now look at your number. If you scored 6 or 7, that is a stronger starting point. You may not be showing as many obvious signs that ED and heart risk could be overlapping right now, and that is good news. If you scored 4 to 5, your body may be sending early signals. That does not automatically mean heart disease is present, but it does mean the pattern deserves attention. If you scored 3 or lower, please don't panic and don't feel embarrassed. Many older men live with erectile dysfunction for years without ever being told that the same blood vessel problems that affect the heart can also affect erections earlier and more quietly. The goal today is not fear, it is awareness. Go ahead and write your score in the comments. I'd also like to know your age, where you're watching from, and which sign concerns you most right now. Is it weaker erections, high blood pressure, diabetes, belly fat? Save your score, because we're coming back to it. Now let me give you 1 minute of simple science. An erection depends on healthy blood flow. That means blood vessels have to open properly, blood has to move in well, and the body has to maintain that response. The reason this matters for heart health is simple. The blood vessels involved in erections are small. So when the lining of blood vessels starts functioning poorly, when circulation begins to stiffen, or when plaque and vascular damage begin to build, problems can sometimes show up in smaller vessels before they show up in larger ones. That is why ED can matter so much. It does not prove a man has heart disease. But in some men, it can be an early clue that blood vessel health is changing. Mayo Clinic and Johns Hopkins both discuss how erectile dysfunction can sometimes act like an early warning sign of cardiovascular trouble, because the same circulation problems that affect the heart can affect erections too. Here is what makes this tricky after 60. Many men have several overlapping risk factors at once. A little more blood pressure, a little more cholesterol, less activity, more belly fat, worse sleep, maybe medications. And because these changes happen gradually, men normalize the pattern instead of seeing the connection. That is why the pattern matters. ED is not always about one isolated sexual symptom. Sometimes it is one visible clue inside a larger cardiovascular picture. So now let's count down the 3 biggest messages your body may be sending when erectile dysfunction could be connected to heart health. We're going from number 3 to number 1, and number 1 is the one most men dismiss the longest. Number 3 is this: your body may be telling you that blood vessel health is changing before anything dramatic has happened. This is one of the most important patterns older men need to understand. A lot of men believe heart disease announces itself loudly. Chest pain, collapse, a hospital visit, something dramatic and unmistakable. But vascular decline often begins quietly. Blood vessels become less flexible. Blood flow becomes less efficient. the body starts having a harder time delivering what tissues need exactly when they need it. Here is how to notice this more clearly. Ask yourself whether the physical quality of erections has declined at the same time your cardiovascular risk has been rising. ED tied to vascular health often feels less like desire is gone and more like the body is not delivering the same firm, dependable physical response it once did. Why does this matter? Because some men will spend years focusing only on performance while ignoring the fact that erections may be revealing something important about circulation. The most common mistake is assuming that no chest pain means no meaningful warning. If you need an easier version of this check, ask yourself one question this week. Could my erections be showing me something about my blood flow that I have not taken seriously enough yet? That question can reveal a lot. Number 2 is this. Your body may be telling you that ED and heart risk often grow out of the same lifestyle and metabolic pattern. A lot of men want one clean explanation, but real life usually does not work that way. The same things that raise heart risk often raise erectile dysfunction risk too. High blood pressure, diabetes, smoking, poor sleep, stress, lower fitness, a body that is less metabolically healthy overall. Here is how to think about it more clearly. If a man's erections are weaker and at the same time he is moving less, carrying more abdominal weight, sleeping worse, and managing more chronic conditions, those are not separate stories. They are often different expressions of the same downward drift. What should you notice? When ED is part of a heart risk pattern, it often shows up alongside other subtle signals. Less stamina, worse blood pressure, rising blood sugar, more shortness of breath than before, a sense that the whole body has become less efficient. Why does this matter? Because if a man treats erectile dysfunction as something totally separate from the rest of his health, he may miss the chance to understand the bigger picture much earlier. The most common mistake is trying to solve the sexual symptom while continuing the exact same habits that are damaging circulation underneath it. If you need an easier version, ask yourself this. Have my erections changed at the same time my metabolism, stamina, waistline, or cardiovascular risk has also been slipping? That distinction matters. And before we move to number 1, if this video is helping you understand your body more clearly, take a moment to like the video and subscribe to American Urologist. It helps me reach more older men who may be quietly living with these changes but have never had them explained in practical, respectful language. And if you've made it this far, let me know in the comments which sign you think men ignore for the longest when ED first begins. Now let's get to number 1. Number 1 is this. Your body may be telling you that erectile dysfunction should not be brushed off as just age when it could be your first visible cardiovascular clue. This is the message men miss the most. A lot of men assume ED after 60 is automatic. They think it is simply what happens. But while age increases the likelihood of both erectile dysfunction and heart disease, age alone should never be used as an excuse to stop paying attention. That is where men get into trouble. They normalize the symptom. They wait. They adapt. They avoid the topic, and they miss the chance to connect it to the rest of their health. Here is what I want you to watch for. Did ED become more noticeable around the same time your blood pressure worsened? Around the same time your energy dropped? Around the same time you became more sedentary, gained more belly fat, or noticed reduced exercise capacity? Are you seeing a pattern, not just one symptom? If several of those are moving together, your body is asking for a closer look. What should you notice if you stop minimizing this? Clarity. Because once you see ED as a possible health signal, not just an embarrassing inconvenience, you stop treating each episode like a separate private failure. Why does this help? Because the bigger picture is what makes the pattern meaningful. One symptom can be brushed off, but one symptom linked to vascular risk factors tells a much stronger story. The most common mistake is waiting until something bigger happens before admitting the early clue mattered. If you need an easier version, remember this. ED is not always just a bedroom problem. Sometimes it is the earliest visible sign that blood vessel health deserves more respect. Now let me give you 3 daily boosters that can help older men think more intelligently about ED and heart health. First, pay attention to movement and stamina. Walk daily if you can. Notice whether stairs, hills, or normal activity feel harder than they used to. Stamina changes can tell you a lot about the direction your body is moving. Second, pay attention to your waistline, blood pressure, blood sugar, and sleep. Those patterns often travel together. Third, stop separating sexual health from cardiovascular health in your mind. And energy together often tell you much more than any one sign on its own. Now, let's close the loop. Think back to your starting score. If you scored low today, don't let that disappear into the background. Recheck yourself in 2 weeks, not because the pattern will magically change overnight, but because awareness changes how honestly you observe your own body. Track whether the pattern feels stable, improving, or quietly worsening. Today, we talked about how erectile dysfunction could, in some men, be an early heart warning that deserves more attention. We looked at how ED can reflect blood vessel changes, how cardiovascular and erectile risks often grow from the same pattern, and why the biggest mistake is dismissing the symptom as nothing more than age. This is not about panic. It is about paying attention before the quieter warning gets lost in the background. Your circulation matters, your stamina matters, your heart matters, and the signals your body gives you matter too. If this video helped you, share it with another man over 60 who has been noticing changes but never connected them to the bigger picture. And if you want to keep going, watch the next video on your screen, where I'll break down the blood flow mistakes that ruin bedroom performance in older men. I'm Dr. James Whitaker. Stay informed, stay steady, and I'll see you in the next one.